Two nurses are blowing the whistle about violent attacks they experienced working in BC emergency rooms, and they say healthcare workers are being silenced. Their stories were included in an explosive lawsuit filed by an emergency room physician against the Fraser Health Authority.
Our emergency system is failing. Frontline providers are not allowed to talk about it.
Fraser Health says it's not able to comment on the lawsuit because it's before the courts, but we're hearing from more people whose stories are in the suit. Victoria Tracy was working in the ER at Eagle Ridge Hospital in January 2025 when a patient threatened staff with a machete. She later told journalists about what it was like inside the ER that day.
We started moving humans as fast as we could, our colleagues as well as all of our patients that are able-bodied.
She says after she gave that interview, she was told by Fraser Health not to come in for her next shift because she was placed under investigation.
To speak out about safety and to speak out about my personal experience, and then to be told to not come back into work due to that was extremely devastating.
She doesn't know exactly why she was being investigated, but she believes it's because she spoke up about what happened. When she asked for more information, she was told the investigation was canceled, but she says she doesn't want to stay silent about the violence hospital staff are facing.
None of us were ever expecting that this type of violence would occur in our careers. It has escalated dramatically, even since I have become a nurse.
The incident is listed in the lawsuit against Fraser Health as one example of a toxic workplace where staff fear speaking out or advocating for themselves and patients due to a culture of retaliation against those who do. A second nurse is also speaking out about a violent attack she says changed her life. Arden Foley was kicked in the head by a patient in November 2024 and suffered serious injuries, including a dislocated jaw. Her story is also in the suit.
I had a concussion. I was severely bruised on my face. My ear was completely swollen and bruised, my neck, and I've had post-traumatic stress syndrome.
She says after 46 years of nursing, she's leaving the profession because of the attack.
Losing my identity as a nurse was what this incident had caused me. I just, lost my identity with my career. And now it's over.
The BC Nurses Union says WorkSafe BC claims connected to violence for nursing staff climbed from 29 a month in 2016 to 43 a month in 2024. That's a 48% increase. In a statement, Fraser Health denies the allegations made by Tracy, saying it did not suspend the agency nurse involved, nor did we initiate an investigation into their conduct. It said in March 2025 it increased security in the emergency department at Eagle Ridge Hospital in direct response to recent violent incidents. Michelle Gassoub, CBC News, Vancouver.